Hello friends, again welcome to my channel. Today we are going to discuss about the pathogenesis, symptoms, prophylaxis and the treatment of human immunodeficiency virus or the AIDS. The human immunodeficiency virus, that is the HIV, it is a causative agent for the AIDS, that is the acquired immunodeficiency syndrome. This HIV, it is a retrovirus of the family lentivirus that contains only the RNA as their genome. It was unknown until early the 1980, but since then has spread around the world to infect the millions of people. AIDS it is first noticed in USA in 1981 and in India the first confirmed case of AIDS was found in 1986 from the Tamil Nadu. The most common type of HIV infection it is known as the HIV first, and it is the type that has led to the worldwide AIDS epidemic. There is also an HIV-2 which is less common. The result of HIV infection it is the destruction of the immune system. It is responsible to affect our immune system, preferentially the cellular immune system. All the HIV infected persons are at risk for the illness and death from the development of opportunistic infection and the tumors and the inevitable manifestation of the AIDS. Now we will switch over to the structure of the HIV, that is human immunodeficiency virus. The family, as we had discussed earlier, it is the Retroviridae. The genus, it is the lentivirus. Whenever we are concentrate on the structure of this HIV virus, it is an enveloped virus, spherical, having 120 nanometer diameter with the two copies of single stranded positive sense RNA as their genome. It is also the viral genome, it is associated with the viral enzyme, that is the reverse transcriptase, integrase and the protease enzyme, which is essential for the completion of the genome replication. Then the protein core. The protein core contains the outer matrix protein layer which contains or consists of the P17 protein. The inner layer it is an capsid protein with the icosahedral symmetry with the protein P24 surrounding to the nucleoprotein. The outer envelope, that is the lipid bilayer, it is uniformly arranged. The 72 spikes of the glycoprotein, that is the GP120 and the GP41, which are essential for the attachment of this HIV virus with their specific host cell. The polymerase antigens or the polymerase genes proteins, these are including the P31, P54 and the P55. The virus replicates in actively dividing T4 lymphocyte, that is the T helper cells, which are the main cells responsible for developing the cell mediated immune response and can remain in a latent stage in the lymphoid cells. Here in this diagram we can observe the structure of HIV virus, which is an enveloped virus and look like the spherical, but the capsid of this it having the icosahedral symmetry. The spikes, these are containing the two specific types of the glycoprotein, that is the GP120 and the GP41. At the center we are observing the two copies of the RNA which are associated with the specific enzyme, that is the reverse transcriptase, which is essential for the replication of the viral genome, because this viral genome it replicates by forming the DNA as an intermediate, and for the conversion of RNA into the DNA there is the requirement of this reverse transcriptase enzyme which is absent within the host cell. For that purpose they will contain their own enzyme. Then the transmembrane glycoprotein GP41, matrix protein P17, glycoprotein GP120, phospholipid bilayer, integrase enzyme, protease enzyme. All of these are the structural components of the HIV. Now the next point within our discussion, it is about the pathogenesis of HIV. Whenever this virus, that is the HIV virus, it enters the host body, then it comes in contact with the suitable host cell, that is the T helper cell. T helper cell, that is the CD4 positive T helper cells, are the host cell for the multiplication of this HIV. The CD4 receptor which is present on the T helper cell acts as a receptor for HIV. The viral glycoprotein GP120 it interacts with this CD4 marker, and then virus host cell fusion occurred by the GP41 protein. The enzyme present within this virus, that is the reverse transcriptase, it helps the HIV virus in the reverse transcription process, that is the conversion of its RNA copies to the proviral DNA. This HIV proviral DNA then get inserted within the host cell DNA by the integrase enzyme causing the latent infection. The primary result of HIV infection is the destruction of T lymphocyte. Due to the reduction in the T cell number, the B cell function it also get reduced, because for the B cell activation there is the requirement of this T helper cells. So due to that it also affects the B cell function, that is the humoral immune response. As a result, HIV patient unable to respond to the new antigens. An important feature of the HIV infection it is the polyclonal activation of the lymphocyte, which lead to the hypergammaglobulinemia. Particularly, there will be increase within the concentration of two specific type of the antibodies, that is the IgG and the IgA antibodies, which includes the useless antibodies against the irrelevant antigens. Means these are of not use, and some are also the autoantibodies, that is the antibodies against the self antigens. These may be responsible for developing the allergic reaction due to the immune complex formation. It also affects the monocyte and the macrophage function due to the reduction in cytokine secretion by the T lymphocytes. Now the clinical symptoms. AIDS, that is the acquired immunodeficiency syndrome, is the only last stage in the wide spectrum of clinical features of HIV infection. The natural evolution of this HIV infection can be considered within the different stages, that is the 5 different stages, and the last stage, fifth stage, it is the AIDS. The first stage within it, it is the acute HIV infection, that is AHI. This acute HIV infection stage it occurs within 3 to 6 weeks of the HIV infection. The 50% of the persons experiences the low-grade fever, malaise, headache, and the lymphadenopathy. The test for HIV antigens at this stage are usually negative at the onset of illness but become positive during its course. Hence, it is called as the seroconversion illness. The second stage within this, it is the asymptomatic or the latent infection, or it is also considered to be the carrier state. It is a symptomless infection or the clinical latency and may be last for 5 to 10 years and then develop into the clinical AIDS. Now, as the clinical latency, it is not means that it is a microbial latency. Within this stage, there is the multiplication of viruses it is carried out, and the cellular and the humoral immune responses against these viruses, these are also get developed within the patient body. It is a chronic persistent infection with the continued decrease within the T helper cell count. The third stage, it is the persistent generalized lymphadenopathy, that is PGL. It indicates the enlarged lymph nodes and lasts for 3 months and progresses into the ARC or the AIDS. The fourth one, it is the AIDS related complex, that is the ARC. It is occur with one or more clinical signs such as the recurrent fever for longer than 1 month, fatigue, diarrhea, night sweat, shortness of breath, loss of more than 10% of body weight. These are the specific types of the symptoms associated with AIDS related complexes. Last and the most important type of the stage, it is the AIDS. It is an end stage of the HIV infection. There was irreversible breakdown of immune defense mechanism. Is within this, most of the T helper cell number it is get lower down, due to which there is the reduction within the cellular immune response. As the cellular immune response, it is also responsible for activation of the humoral immune response, that is the B cell activation. So all over the immune system of the patient's body it will get decreases, and due to which the affected person it is susceptible to the life threatening opportunistic infection, which includes the pneumonia, tuberculosis, or the Kaposi sarcoma. Now we are switch over to the modes of transmission of HIV. Now there are the most important 3 different modes of the HIV infection. Majorly the HIV it is transmitted through the exchange of certain body fluids from an infected person. The casual contacts with the infected person it is not responsible for the transmission of the infection. The most important mode of the transmission of HIV infection it is the sexual contact. HIV can be transmitted during the vaginal or the anal sex. Then the sharing needles. HIV can be transmitted by sharing the needles, syringe, or the other drug injection equipments within which there is the direct contact with the blood. The blood transfusion, HIV can be transmitted through the contaminated blood transfusion. Pregnancy and the childbirth, HIV can be transmitted from the mother with the HIV to their child during the pregnancy, childbirth or the breastfeeding. This is called as the perinatal transmission. Now we will switch over to the diagnosis of the HIV, that is the laboratory diagnosis of the HIV. Majorly the HIV diagnosis it is done by using the ELISA test. ELISA test it is a common antibody test to detect the HIV infection. ELISA it is the enzyme linked immunosorbent assay and a common technique utilized for the detection of the HIV infection. The enzyme linked immunosorbent assay tests a patient's blood sample for the presence of antibody against the HIV. The oral fluid, not the saliva, it is collected from the cheeks and the gums, may also be used to perform an ELISA. The oral fluid ELISA tests are considered as sensitive as the blood test. A positive ELISA for all samples must be used with a follow-up of the confirmatory test. And the confirmatory test, it is the Western blot test to make a positive diagnosis. When used in combination with the confirmatory Western blot test, the ELISA tests are 99.9% accurate. Now the steps which are involved within the enzyme linked immunosorbent assay, which is a diagnostic method for the diagnosis of HIV infection. Within this, the buffered solution of antigen to be tested is added to each well of microtiter plate when it is given time to adhere to the plastic through the charge interactions. The solution of non-reacting proteins such as the bovine serum, albumin or the casein it is added to the wells, usually 96 well plates, in order to cover any plastic surface in the well which remains uncoated by the antigen. Then there is addition of the primary antibody which is attached or conjugated with the enzyme. It is get added which binds specifically to the test antigen coating the well. Then there is the addition of the substrate. This substrate it is specific for the enzyme which is associated with the primary antibody, and this substrate changes the color upon reaction with the enzyme. Higher the concentration of primary antibody present in the serum, the stronger is the color change, and often a spectrometer is used to give a quantitative values for the color strength. And by this way, if the color change it is observed, it indicates the positive test. Now the treatment of the HIV infection. Now there is no cure for the HIV or the AIDS. Once you have the infection, your body can't get rid of this infection. But there are the medicines that can control the HIV and prevents the further complications. Everyone diagnosed with the HIV should take the antiretroviral therapy medicines which is called as the ART. ART it is usually a mixture of two or more medicines from the several classes. Each class of medicines block the virus in the different ways. Account for the medicine resistance called as the viral genotype, or it avoids the creation of the new medicine resistant strains of HIV, suppresses the viruses in the blood as much as possible. Then the next one it is the protease inhibitors make the HIV protease inactive. HIV protease it is another protein that HIV needs to make the copies of the itself. Examples include the atazanavir, then the darunavir and the lopinavir and the ritonavir. The integrase inhibitor which are the specific enzyme for the viral replication, that is which stop the action of the protein called the integrase. HIV uses the integrase to put its genetic material into the CD4 T cells. It includes the bictegravir, sodium imitragesitabine or the tenofovir, alafenamide fumarate, then the reltegravir and the cabotegravir. Then again there are some types of the medicines for the entry of fusion of inhibitor which blocks the HIV entry within the CD4 T cells. Examples includes the enfuviratide, then the maraviroc. The newer medicine include the ibalizumab, Such type of the antibiotics, these are utilized for the to avoid the multiplication of the viruses, to avoid the progression of this HIV infection. Then the prophylaxis includes the people should be educated about the HIV transmission, how there is the transmission of HIV infections. Then the disposable needles and the syringe should be used and disposed of properly. Avoid the unsafe sexual contact. The proper blood testing should be done at the time of blood transfusion and the organ transfusion. So it is whole information about the HIV. If you like this video, please subscribe my channel and also share this video with your friends. Thank you.